an interesting topic to discuss: abusing drugs in contemporary times, health risks, and mental health implications. What you can do. You are most welcome. My name is Dr. Yao Amankwa Arthur. I'm head for health promotion. Today, we have with us our own Prof, the Chief Executive, Professor Akwesi Osei. He is a member of the panel for today, as well as Ms. Akusia Sewabunsu. She is a clinical psychologist at the Eastern Regional Hospital in Koforidua. In addition, we also have Dr. Eugene Dodoi. He is a consultant psychiatrist at the whole teaching hospital, as well as HOD at UHAS. Today, we don't have much time. All my panelists want me to go by time, so we need to run into the program. Before we start, ladies and gentlemen, permit me to go through the housing rules. And for starters, please, if you just join us, do well to mute your microphone to avoid any distraction. Again, drug abuse, mental health. We are discussing a sensitive matter here. So in your questions, in your comments, in your reaction, please be as sensitive as you can be. And finally, during question time, as usual, how we do it all the time, raise your hand and I'll ask you to make your input. So that is by way of introduction. Before I go on, let me hear if my panel members are around. Professor Kwesi, can you hear me, please?
Yes, I can hear you loud and clear. Thank you.
Fantastic. Good, good. Dr. Eugene Dodoi, can I hear you?
Yeah.
Dr. Eugene.
Yeah.
Okay, great, great. I hope
Good.
today the fire
be on the show
limited.
today. Yeah.
You came with your small fire, I hope.
That is a friendly fire.
That's a friendly fire, I must guess. Akosia, can we hear you? Akosia, unmute yourself and let's hear you.
I can hear you.
Okay, good.
Yes,
so
I can hear you.
Fantastic. All my panel members are around. I think I can also see Dr. Odamin is our usual panel member. I can see him there. All right, so this program is related to commemorating the International Day Against Drug Abuse and Illicit Trafficking. And the theme that was chosen was addressing drug challenges in health and humanitarian crisis. And in fact, Narcotics Control Commission had a program at Aliza. I was there with Prof. And the issue that was discussed was that so much effort is being made at curbing this problem. At the end of the day, Prof was also interviewed on several media stations, and yes, admitted that drug abuse is a problem with us, but the most important thing is taking care of them, rehabilitation. We don't need to throw them out. We don't need to incarcerate them for doing drug abuse and all that. We need to take care of them. Treatment is available. We need to rehabilitate them. So for us, out of this team, we also chose abusing drugs in contemporary programs, the health risks and the mental health. I temporarily dropped off. So today we are going to have a question and answer session. We want it to be as interactive as possible. So as the question goes on, I would entreat panel, our participants, as usual, send your comments through the inbox or questions. I'll pick them and read them. But we'll do a question and answer session so that we can all follow the discussion. So Dr. Dodo, let me come to you. Well, okay, probably I would allow my panel members to make a comment with regards to the topic, then we go on with the questions. I think your comments would answer my first question. So let me start with you, Dr. Dodo.
Sure. Yeah, okay. So, yeah, I mean, I think this is very important looking at the international theme and what we have, because a lot of the times we think drug abuse is hard drugs alone. That is cocaine, heroin, marijuana, and now even with marijuana, there's this debate about what the Peter Tosh sang, legalize it, you know, so whether it should be legal or not. The challenge now is abuse of prescription drugs, mainly the opioids. So with the crisis in the world, I mean, Afghanistan, for instance, they're producing a lot of opium. And with the international laws and stuff, now China and the West, they are producing synthetic opioids like fentanyl, which is probably more powerful than even the heroin or the opium itself, you know. And we are getting many young people, we are getting people who are, I would say, highly productive in society.
Dr. Nada, hold on. You're always on fire. You have this small thing, you see how you are firing. This small things, this small comment, no.
Yes, I'm just beginning that the hard drugs are not those ones, but now we are coming home to the drugs like pethidine, codeine. I mean, now these ones are the prescription drugs, which most people thought these are not bad, but unfortunately, we are getting there, and it's seriously harming our youth. I mean, in fact, the brain and brawn potential of Ghana. Thank you.
Okay, it's okay. Leave some for the others. Prof, are you there?
Yes, I'm here.
Okay, your comments on the topic.
Well, thank you very much, and very good afternoon to you all, both panelists and participants. Well, I would have wished you didn't restrain Dr. Dodoe.
He's too much on fire. If I don't control his fire, he will burn us.
Never mind, let him go on. The topic is so important and with so many dimensions.
Yes.
That I think just allow it. Now, the point is that just as Dr. Dodo started, it has different dimensions and is becoming more and more complicated. The one significant dimension is that we are having younger age groups coming into the picture than in the past. And that means something that we need to give serious attention to. The emphasis the whole world is also placing on it is not exactly, as we discuss, we go further, they are looking at more of the criminal component than the disease component. Thank God this year, there's a recognition here. We are looking at the health implications. So we are looking at the medical component. But this emphasis should have been much, much earlier than today. But that is an aspect that we need to look at. The health aspect as against the criminal aspect.
Me go
And
over
then
back.
also we are getting a wider variety of.
Madam Lydia Forsen, can you please mute yourself?
Or mute, mute. And then the other aspect, which is the third dimension I want to bring about, is so we've talked about the age of onset, which is being lower. We are also talking about the worldwide emphasis on the criminal component with a slight shift today, which is good. Criminal component with a slight shift now to the medical component, which is good. And also the wider variety. In the past, when you talked about, just as Eugene said, when you talked about drug abuse, we are talking about those drugs, the known drugs of abuse, drugs of addiction. And now we are having what an unsuspecting extent of it with the prescription drugs, which you need to recognize. Plus even other angles of it as you move on, the lacquer and whatnot. So it's becoming more and more complicated. And I must say, the fourth component of it also is what I would call the craze of the world, not, in our liberalization and permissiveness, allowing some things to go ahead because of a positive benefit or a potential benefit of that aspect. I'm talking about legalization of cannabis. Now, a certain extent of cannabis, the medical use and the industrial use, that is legalized, no problem about that. But it has a flip side that in countries like ours, where we are not prepared adequately to handle the side effect of people using the unpermitted drug, are so grievous. So these are all complications that we need to record as we move on. So we'll be discussing this.
All right, thank you, sir. Thank you. That's quite an angle that you drew from. Akosia, would you like to add something quickly?
Okay, so good afternoon and thank you for having me. I also see this topic as very important, and then the time looking at it is also quite crucial, especially at this time where economic situations across the globe is kind of a bit difficult. We're having changing times and difficult times, and this is where people tend to use various drugs in a way to adjust to situations maladaptively. So I believe it's a very important topic to discuss at the moment. Yeah, thank you.
Thank you very much, Agusia. So to pick from where you just ended, so in what normal ways that I think that I'm taking care of my health, I'm medicating, I'm taking some medicine to deal with my health, but in actual fact, I'm abusing the drugs. In what normal ways do we do some of these things, if you can point them out to us?
Okay, so firstly, I would like to point out taking certain medications or substances in a way to feel good. So one may think that when I take this drug or this medicine, I feel good. So you keep taking it. Again, it may be out of curiosity. And then when you take it and you feel good, you end up doing it. And by so doing, it affects a person's normal daily life without you even knowing that you are using that drug. So that's what I have.
Okay. Well, Dr. Dodoy, pick that other angle. I have headache, I have back pain, knee pain, and I'm taking medications, but I'm taking it, but in actual fact, I'm abusing it. Describe in what ways do I do these things when in fact I think that I'm taking care of my health, but I'm abusing it. How do you do these things generally?
Yeah, so that is, where the big challenge or the biggest challenge is the transition between experimental use, therapeutic use, and then abuse. So the transition is not that sharp for one to realize that I have done this. So, and that is why this becomes a health, or it becomes an occupational hazard for health workers. So you have pain, definitely as we all grow older, with our size and all that, we get arthritis, we get pains and all over. And then we need pain meds. Okay, so when we get these pain meds and we realize it appears this is not just a pain relief, but I really love the feeling I got from this. So, and that is where the challenge is. So there are people whose brains are wired such that when they get that feeling, they cannot stop there. So even when they don't have pain, they might want to go for the feeling, compared to others who would, yes, I enjoyed it, but the feeling made me feel some way after, or the withdrawal or something, so they wouldn't do it. So the challenge is that people are, we say they are born to become addicts. So whether, just like hypertension and diabetes, we may be born to have hypertension, but it will come later in life. So for people whose brains are saying that they are likely to become addicts, when they start experimenting, when they start even the normal treatment, and then they go beyond normal treatment and think because they are health workers or they have some health literacy, they can manage their own pain, especially with the opioids. Unfortunately, they get hooked onto it. Let's note this. It's not everybody who try a substance of abuse like alcohol gets dependent on it. There are people who are by nature, how their brains are wired, are likely to go on using when they start something like that. And there's no way to know who can become, only when you become. We can only look at risk factors if you have a family member who has the condition, you have a family member. We can look at the risk, and say that you may be high risk, but we can't tell exactly who will become. So that is why all of us need to be very rational in our taking of pain meds, especially because the higher the pain or the more severe the pain gets, the more you want a stronger pain medication. And as the pain medication gets stronger, you get into the opioids. They can take care of very severe pain, but they come with associated, feeling, which is high and all that. And that is when, if you are wired to get addicted, then you get hooked on. Like Professor said, marijuana has got some kind of pain relief and also give some feeling. So it's the same thing. You might try it to help with something, but if you are pre-wired to become an addict, then when you start, you can't stop. So it's a very challenging thing. And as Prof said, we need to move away from the legalization or the criminalization and the policy part to see it like a disease, like any other disease, and adopt the public health approach we do for all conditions which become epidemic. We know that addiction is now an epidemic in the West. In the US, in Europe, yes. I don't know how long we think we don't have the problem because we don't have data. Nobody is collecting data. So we don't even see how severe the challenges, and we think we don't have a problem. But in reality, we may have a real serious challenge that we have to address, and we need to address it with a public health approach to solving all disease which become epidemic, and not think that we can make laws, because if laws could treat this condition, I'm not sure America would have it. They have all the laws, they can implement them. They still have the challenge. So we shouldn't think laws can, treat addiction. Thank you.
Recording in progress.
Thank you very much. Thank you very much, Eugene. I think that I would allow Prof to make an input at this stage. Prof, you did mention LACA. What is that? And I know it's something that they do take. So maybe you can add the common drugs that are abused to the LACA that you mentioned. What is that LACA?
Carpenters use it to shine their instruments, to shine their furniture. So they use it to polish. Yeah, that's the way, to polish the furniture. So when they do the table, the sofa, the chairs, and they use that material to polish it. In fact, it's also used to remove some stains that you have on your material. So lacquer is like turpentine. So these are materials that have their special purpose in the carpentry work and whatnot, but the youth have learned to abuse it in a way that they take it, they can add it to alcohol, and they take it and they feel high, and that will let them continue to be taking it, and that is dangerous. There are other substances, indeed. There was a time that we tried to do a program and we said, okay, let's go to town and see what it is like to interview people. It might interest you. What we found out, for instance, was that at the filling station, you may see the youth standing, some maybe teenagers standing by the filling station, and you think they are just idling about. They are actually inhaling the fumes coming out of the diesel, the pumping station, and they feel high. That is one thing. We also know people use the droppings of lasers and the white at the end, and they mix it with alcohol and they take it and they feel high. In fact, we also even know that some take the pad, the sanitary pad, and they squeeze it, the menstrual flow out of it, mix it with all kinds of chemicals, they take it and they feel high. This we have known that in the country. In fact, even what is not known is that elsewhere, they even take HIV drugs that we know are very helpful in saving HIV/AIDS people, and they crush it and they take some substance out of it, and they take it and they feel high. So people are generally just becoming experimental. Whatever when they realize that what they are taking normally does not make them high enough, then they want to experiment something. Somebody tries it and it works, and then it becomes an epidemic. They all try it. So they are trying something new every now and then, and these are really, really dangerous. Of course, you've also mentioned about the prescription drugs that are commonly abused among health personnel, the pethidines, the sourcicals, and whatnot. But let me also add one point. With the prescription drugs, for instance, I have a close family member who, under some circumstances, goes through some conditions of pain. We've been through various places and we don't seem to get, in fact, the recommendation for the final treatment, they themselves also say that even though that would be the definitive approach, it's not recommended given the circumstances of the condition and, given the circumstances. So we should use conservative methods and maybe just let it enjoy it. But frankly, when this situation, the pain comes, then I feel like going the opioid way, because that actually would be recommended in that circumstance. Opioid way, give some opioid, pethidine, and whatnot. But given what I know of that person, you give it once, it relieves the pain magically. Trust me, next time it comes, she'll go for that and will eventually become addicted. And that will be a bigger problem. And again, this addiction issue, prescription drugs issue, medical personnel are more guilty of it in terms of re-inducing it. We call that iatrogenic. Like you are a nurse or a health person, you've gone for surgical procedure or even gynecological procedure, cesarean session to get your baby out, and then you are in pain. Maybe somebody else, you'd have just probably given paracetamol to get the person to endure a little and then for the pain to go. But you see your own colleague in so much pain and you feel like relieving it. So you go for the opioid. Once you release it, next time the person has the pain, she will beg you to give the pethidine to relieve the pain. And next time, even without the pain, because of the high effect that it gives, even without the pain, when a person feels a little depressed, she will, this time, not asking you, the prescriber, to give, but because she has access to it by virtue of her being a medical personnel, go for it, and then the addiction comes in. So these are areas that we introduce it. Somebody goes for a surgical procedure, maybe or hip joint operation, or somebody with sickle cell, and opioids are currently amongst drugs you use to treat sickle cell, which is true, I know. But then if you don't measure it and you give it recklessly, I must say, you are inducing this person iatrogenically for addiction. And when it happens that way, they become suicide. And we see many cases like that. So these are other dimensions that we need to recognize so that as we discuss them, we see how we can tackle them holistically.
Okay, so in short, in the layman language, prescription drugs that has to do with pain we need to be careful when we are taking them. When it's being,
we need to be careful. You certainly need to be careful. Another drug, for instance, that you have a challenge with sleep, and then you give it to induce your sleep, to help with your sleep. These drugs, you should not give it for more than 1 week, maximum 2 weeks. You give them more than 2 weeks, you are getting the person addicted. And this is commonly happening. We see them every day. Somebody comes to the psychiatric hospitals, and this person has been on this drug. And where was it given to you? A general hospital. Somebody can be on it for 1 month, 2 months. And we call these drugs hard drugs in the sense that, or we call them hard drugs because there's a high addictive potential. In other words, greater chances than other drugs for you to get hooked onto them, for you to get addicted. And addiction, by the way, is a disease. I was on a platform where people felt that, well, somebody has caused this problem for himself, so why should I sympathize? Truth really is that when you get to this point of addiction, it's no longer your fault. It is no longer under your control. You are a slave to the drug. So at that point, we should simply treat you as having a disease with all the empathy and sympathy, and not to say that you brought it upon yourself.
Thank you, Prof. So you've added another one. So for me, take home, painkillers and sleep drugs, I should be wary of them. I should be very, very particular, careful with them. Okay, so
on prescription and not self-medication.
Not self-medication. Okay. So Akosia, is there an underlying psychological reason for this deliberate or non-deliberate of abuse of drugs in general?
Okay, so while the exact cause of drug abuse or substance use disorders is unknown, putting aside the genetic influences, we have certain psychological factors that contribute to drug abuse or addiction. And an example is stress, where people use substances as a way of coping. You can also have people abusing drugs when they feel they're isolated or they are in isolation. Discrimination and even existing mental health conditions such as depression, anxiety, and bipolar can be a reason or a precipitator for drug use among people, which later end them up becoming addicted. Yeah. Again, also, let me add the influence of unhealthy social environments. So where we have attitudes and belief of families and friends, peers around us, what they do, we look at all that and then we model social modeling, we model them to start abusing substances.
Okay. So from your experience, Dr.
It appears I can't hear you very well.
What have you experienced in the consulting room with regards to this?
With regards to which one?
Hello, Dr. Dodo.
Yes.
Can you
hear me?
With regards to the use of this, what have you experienced? Yes, we can hear you now.
Okay. Yeah. So you mean is it with regards to the prescription drugs or with regards to what? You were breaking at some time.
Akosia responded with regards to the psychological underpinnings for the use of these drugs.
Okay.
And I'm saying that what have been your experience in the consulting room when people come to you and they have such issues?
Yeah, so just like Akosia said, we don't have what we call a causality. Like if somebody has a malaria, we know the person has had either a mosquito bite or a transfusion that contained the parasites. You know, we don't have that with addiction. So it is multifactorial. And we know that there are conditions that make people start, which are different from conditions that make people continue their use. So when people have all these challenges Akosua mentioned and Prof also mentioned, I mean, it will get them to start using, it will get them to try to experiment. And the challenge we have had is that when it gets to the level where they are ill, they have the disease addiction, as Prof mentioned, it goes beyond the person. So, and at that point, because we know disease as pain or distress, but these people don't seem to show visible or observable distress or pain, we think that they are actually doing it intentionally, because in fact, you need to be very smart to be able to lie and manipulate people to be able to get and use drugs. So when they have all these symptoms, that is what makes people think, no, these guys are not ill. They are just trying to outsmart everybody. But the challenge is that they themselves actually want to quit, but they are unable. So they adopt behaviors that make them continue to use. And these behaviors will be cheating, lying, or manipulation. So when they are doing these things, I mean, it shouldn't be the challenge for us, which is commonly the challenge for health workers and even other people, thinking that, no, this guy is not sick, he's just trying to be smart and all that, when in fact they are very ill and will need therapy. So our challenge has been, especially in Ghana, has been our inability or our unpreparedness to accept that addiction is a disease. And let me give a very simple analogy, which probably people would, can align themselves to. When people have asthma, okay, and they get asthmatic attacks, we know it's because they more or less expose themselves to the allergen that will trigger the attack. When people have hypertension or diabetes, or even just being Black, we know that we are prone to getting hypertension and diabetes. So if you gain weight and you are overweight or obese, then it means it is something intentional, which you are trying to increase your risk of getting hypertension and diabetes and therefore get a stroke or heart attack. So we should therefore punish anybody who is obese, anybody who is, get their BP uncontrolled, anybody who gets recurrent asthmatic attacks, because they should know what to do. So when we think that people should know what to do, they went to get the drugs themselves, so therefore they deserve to be punished, then we have missed the mark. So it will just be like saying that I gave you time to lose weight. So the whole of, 2021, I asked you to lose weight. You've not been able to lose up to 10 kilos. So probably let's demote you, let's jail you, let's punish you. That person does not make sense. And that is exactly what addiction is. So when people have it, when they've gone beyond the experimentation to just treat their pain, and now they use it when they don't have pain, it's gone beyond them. They are now ill, and they should be seen like any other person with a chronic condition, and the empathy they deserve, they need to be given, and then we need to treat them. I may admit that even as a country, the Ghana Health Service Occupational Health Policy failed to address this point, and somehow in the policy, which is made by us, the health workers for the country, still stating somehow that addiction should be punished. Like if you are found drunk at work, if you use illegal substances, these things are punishable. And I think it is quite unfortunate. And probably such a program, which the Mental Health Authority has kind of like smartly put out there, would help change the narrative so that we begin to think of addiction as a disease model and approach it similarly, like Prof said. Thank you.
All right, let me play the devil's advocate here and allow Prof to support you. Prof, I decided to do my own abuse. Now it has gone into addiction. It is not my fault. It is now a disease. Now, I want you to support Dr. Dodoy's argument that it is an illness that people require empathy and support.
Yes, to start with, let me go back to the point of health workers and our policies not regarding addiction as a disease. We are making efforts to rectify that. As we speak right now, the Mental Health Authority is coming out with a policy to guide workers who we call difficult workers, difficult staff. They may have difficulty, or they may be difficult staff for various reasons, including the fact that they are abusing substances, they are abusing alcohol, cannabis, or whatever. We are recognizing that they have a disease, and we are trying to put in place a policy to guide managers of the health bodies, and not only health, but managers of various organizations and workplaces, to know how to help these people and not just simply to punish them. We are hoping that this kind of policy will come in place very soon. And when that happens, we will entreat everybody to look at that, because the truth as we understand it now, when somebody gets addicted, he has a disease. And by definition, addiction is a chronic relapsing disease of the brain due to exposure, constant or chronic exposure of the very substance that led to the addiction, and which leads to uncontrollable use of the substance, even when there is danger to the person. And that is why you may see somebody with a puffy face, shaking, head faint, abdomen bloated, obviously from side effects of alcohol. And yet he wakes up in the morning, then he goes to the blue kiosk to go and take a tot. He doesn't take much, just a tot. And then when he takes it, he feels fine, because he has an uncontrollable use of the drug by virtue of the disease that he has, addiction and any other thing. So now, directly to your point, what if I'm taking it? Why should you still continue to give me your empathy and not to treat me as a criminal or somebody who is a bad boy, who is morally defective, and therefore treat me as such? What we are saying is that at the time the person began to use it, just recreational purposes, social purposes, peer pressure, yes. At that point, you could say, hey, you have been a bad boy, you have been a naughty boy, stop it. You could have advised him. But once you miss the window of opportunity for the advice to pull him out, and he continues and he gets to the point where it is outside his control, at that point, he has a disease. He has what we have defined, as I just gave, a chronic relapsing disease of the brain. So at that point, it's no longer his fault. Once you know that it's no longer his fault, then you can't blame him. How he came to that point is no longer an issue. It's like we have a proverb in tree. You say about Franoma on court efiso. Na okot no wakokana yenya drew. To wait, the child should not go to the toilet there in the bush, because it's a rodent and the rat and reptiles infested. So if you go there, something can happen to you. Then the child disobeys and goes to the toilet there in the bush and is bitten by a reptile and he is dying. Are you still going to punish him for disobeying you, or you are going to treat him? You just have to treat him, ignore why he went there and how he went there, and treat him for the disease of the snake bite. And when you are done, then later you can go back and revisit why he disobeyed you. In the same way with somebody with addiction, once he's addicted, he has a disease, and we need to first and foremost recognize that the pathway towards the addiction is not important. It's no longer material. Just treat him. And when you have treated him, then in order to prevent him from maybe going to get himself exposed, then you can revisit that point of, why did you disobey me? So that exactly is the nature. But many of us fail to recognize that. And incidentally, it looks like, well, many people fail to recognize that, including many, many health professionals.
Thank you very much, Prof. I think that Prof has beaten all of us to this argument with the proverb. So if you do not understand it, you have a proverb to guide your understanding of the issue. You've asked your child not to go to the Hitu. He or she goes there, is bitten by a snake. Your child is dying. Are you going to watch your child die? No. You try to save the life, then after you deal with it. So it is with addiction. Thank you very much, Prof. case closed. So we need to not punish those with addiction. We need to take care of them in the community. We need to support them to be well. Then later we can deal with them. So Akosia, let me come to you. Of course, there are health implications, right? So what are these health implications? What are the health risks associated with drug abuse?
All right, thank you. So with the health risk, it differs, or the effects differs from individual to another. And this is based on the fact that the kind of drug that is taken, the dosage that is taken, how long the drug is used, and even existing health problems prevalent in the individuals also contribute to the impact or the extent of effect on the individuals. The effect can generally be grouped into physical, behavioral, and then of course the mental or psychological implications. All right, the health risks, if I should start, I would say using alcohol as an example, where people may start to use it as a form of like for relaxation or to kind of feel good, among other things. Within few minutes of taking in or consuming alcohol, it is absorbed into our bloodstream by blood vessels that are present within our like the lining of the stomach and also small intestines, which travel to the brain. And bringing us back, the common drugs of abuse, or the drugs that we noted, they are known as psychoactive drugs, and that is because of the effects that they have on the brain. When this happens, the alcohol travels through the bloodstream to the brain to have its effect, and it affects us by interfering with brain communication pathways. And this goes a long way to impact or interfere with brain functions, commonly among which are balance control. We have it even affects speech, judgment, and then memory. So these are some of the health risks that we have. Also, alcohol, for instance, because it is difficult, or because of the difficulty in processing alcohol, it also exerts extra pressure on the liver, digestive systems, cardiovascular systems, and other functions to cause other medical or physical conditions. All right. So if we should look at it step by step or categorically, as I mentioned, the physical effect also, we can have what we can have some it's affecting pattern of sleep. So we have people either sleeping less or sleeping more too much, which is insomnia or hypersomnia. We can also have among the physical effects, poor personal hygiene, and that can be visible where we have people neglecting their physical cleanliness, among others. And again, it even causes or has effect on the skin, our complexion. So people who have a long or prolonged drug use tend to develop acne, there's jaundice, paleness, among others. Now, if I should move to the behavioral effect or the behavioral impact, people tend to be very secretive, and that is because they are often occupied or preoccupied with looking for private places to abuse their substances. They also ignore responsibility. So be it at home, in school, or even at workplace, they ignore all responsibilities. All right. Then we can also have people experiencing financial distress, and this is demonstrated by their indiscriminate borrowing of money and also selling of their personal belongings just to afford expensive illegal drugs or illicit drugs that they abuse. Then coming to the psychological effect, we can talk about the depressions, the anxieties, and all that. We can also have low self-esteem, and that is because people who abuse substances have a significant decrease in their confidence, in their looks, and even in their intelligence. They don't have confidence in all this. And we can also have people having difficulty, like poor motivation. Even though they set up high targets, they are unable to execute those targets. And then we can also talk about irritability, mood swings. So people become suddenly agitated, and then they demonstrate unprecedented or predictable temperament, be it at work or anywhere that we have. Again, I cannot talk about the effects of abusing drugs without noting the significant impact on our job performance. So we have examples like absenteeism as a result of hangover and all that, poor decision making, and where people are unable to make decisions due to the fact that they are constantly thinking about the drug to use and then where to use them and how to afford these drugs, among others. We can also have people engaging in a lot of arguments because of it could be due to poor judgment or not even being able to concentrate well these certain decisions that it is for. And you can also talk about thefts, be it at the workplace or anywhere. So people can still, even from the workplace, to be able to afford their drugs. And that leads to other legal issues, stealing at work or theft at workplaces and all that. So these are some of the effects or the impact of drug abuse. I can talk about.
All right, thank you very much, Akosia. Well, that means that the risk and the effects are quite enormous. We have a problem at hand that if somebody is abusing drugs, that person, yes, would face health risk. And are you there? Hello, Dr. Dodoi.
Yes.
So from your practice, what do you think is the magnitude of this problem in this country?
That is, this is a huge question. And I could see Akosia struggling to, put everything in there. And I'm trying to make sure she doesn't talk for too long, and yet, not sure what to take out. And I might say, even with that, a whole chunk is not, she didn't mention a whole chunk. In fact, what Akosia has mentioned are, a minority, because it is largely about the individual. We can have it at the societal level, implications. We can have it at the national level, the implications. We can have it at the international level. So I won't go into all that, and I'll use that to tell those who want to talk about the enormity of the problem. But if you come to the person, which Akosia mentioned, we used to say in medical school that no alcohol and know the whole of medicine, meaning that alcohol abuse can cause almost every disease we know about in the world. So I can just start from the head and just run us down.
Really?
Oh yes. In the head, we can get epilepsies, we can get, fainting spells, we can get strokes because we are drinking too much. That alone ends the head. In the eye, it can give you a glaucoma from a diabetes. It can cause some blindness and all that. When we come to the chest, in fact, people with alcohol get some kind of pneumonia, which is very difficult to treat because the antibiotics we need are very expensive. They get some particular organism that kill them the more. And unfortunately, their pneumonia tends to be more than one organism affecting them. So we call it polymicrobial. It's very difficult. We know alcohol can cause all the cancers from your mouth to your anus. So oral cancers, your cancer of the esophagus, cancer of the stomach, cancer of the small intestine, cancer of the large intestine. We can also get peptic ulcer. We can get bleeding either from your mouth or per your anus, what we call upper GI bleeding or lower GI bleeding. And all these are caused by alcohol. So in the chest, again, we have what we call alcoholic cardiomyopathy. And this is one of the things I tend to feel very sad about, in the sense that by definition, cardiomyopathy, we don't know any treatment for it. So once it starts, we only give you medicine to keep you alive till as long as your heart will allow you to live, whilst you stop damaging it. So once the cardiomyopathy is setting, we can't do much. Unfortunately, a few of the people I've seen were in their 20s, 28, 27. It's very young people who die a heart condition. When you come to your abdomen, it can damage your kidney. Akosia mentioned it can damage your liver. It can give you, a liver failure, a kidney failure. It can give you something like a kwashiorkor, where your abdomen, which in Twi they will say more like somebody has cursed you, So, and alcohol can make you infertile. And this is what many people do not know. We usually don't talk about cause, but alcohol can cause impotence. So the men cannot go on their long journeys again. So their fire will quench. And then it can cause what we call peripheral neuropathy, where you stop feeling in your legs, and if you get a wound, we can't treat it and all that. So with all the many medical conditions alcohol gives, so when somebody is drinking or using other drugs, they are not only harming themselves, because when all these people fall sick, they fall on their national health insurance. So what essentially it is that when they use their money to buy alcohol, all of us pay tax to treat that person. All of us have to pay tax to make sure there's a bed for that person when they are sick. So apart from they not going to work, as Akosia mentioned, absenteeism, they actually spend time in the healthcare system and costs all of us more. So because of them, we say there's increased cost of healthcare, and we have to pay more for health insurance, and that is on that side. And we know from studies that if you take alcohol alone, 1 in every 10 people that you take, is likely to have alcohol dependence. And it is, 3 times more likely in a man than in a woman. So even alcohol alone, we are talking about, if we are talking about 30 million Ghanaians, and about, half of us, like 15 million are adults. 10% is about 1.5 million people of Ghanaians are likely to have alcohol addiction. So this is not to add all the other, addictions that can come into play. So that is how many people we need to be treating for alcohol addiction. And that's how many people we need to work to prevent from getting there. But we know if we leave them and get them exposed, this is about 1 million people we are going to have in Ghana all having a problem with alcohol alone. So that is why the intervention is so important. When it comes to the other drugs of abuse, unfortunately, people don't just abuse them. It goes with, crime. And it's not like we don't know. In the West African state of Guinea-Bissau, in fact, there was a coup d'etat just because the drug laws have changed hands. So when people are trafficking drugs, like in Ghana or the whole of the west coast of Africa, we are a transit point for the opium or heroin from Afghanistan, and then cocaine from Mexico and Latin America in general. So, and we become a transit for them to send to Western Europe and North America. So when these things, they leave some of the drugs here. And before they can leave the drugs here and send them away, that means they have to pay off the immigration, the airport, the narcotic control. Sometimes they have to pay charges and all that. So we see that if we don't take care, the drug money is what will control our politics. And therefore, we are virtually going to end up electing drug lords to become our politicians or our leaders of the nation. And this is not far-fetched. Don't forget, US arrested a sitting member of parliament. He was a sitting member of parliament, and he was trafficking drugs. Okay, so these things are not far-fetched from us. That if we don't take care, the very thing that we think we live for, the democracy that we have, if we don't treat that person in my neighborhood who is abusing drugs, that person will engage in criminal activities that will overthrow government, that will overthrow our institutions. And by the time we will say, Jack, we'll have, this challenge with us. And our problem is worse in the sense that we don't even collect data on drug abuse. The ones we know are those who are so ill and have presented to the mental hospitals. But those who are presented to mental hospitals, they are a minority of the larger, population. And this is a disease of young people, unfortunately, young people, okay? Studies show that for people, who start drug abuse, alcohols, nicotine, everything before the age of 19, 1 in 4 of them are likely to become addicted. If we're able to push them to start using drugs after the age of 24, it's 1 in 25 become. So largely, older people would hardly become addicted. So it's a younger brain that we need to protect. So if we are not collecting data to put in any intervention, what we are doing is that we are losing our young brains to drug abuse. And if we lead them to drug abuse, who do we think are going to lead us in future? It's these same people who are abusing drugs. And if we don't take care, all the things that we are working for today would all be brought to naught. And that is why we say that addiction, people with addiction become counterproductive. So they do not only not produce, but they also come and rob us who are producing for the small productivity that we give to the country, for them to buy more drugs, for them to stay healthy, for them to continue to use their drug. And unfortunately, they may have to maim somebody, kill somebody, commit some crime just so that they can use drugs. So if you want to look at the challenge of drug abuse, and its implication, we can start from the individual person, both their physical health, that is their medical conditions like pneumonia, heart failure, kidney failure, liver failure, stroke, and all of that. We can start from the mental health, which is they become addicted, they get mental health conditions. We can go to their social implications. They can't work, they may not finish their training and all that. Then we come to the family, because if my father is drinking, I will have to lie that my father is sick on a Monday morning when I know he's having a hangover. So the family will also have to pay a price. Then the community the person is in, the district mutual health is going to pay for my healthcare if I drink too much. Then as a country, we all have to, pay the price for if these people commit crimes and get into politics, then they come to rule all of us. And that is how they then can even get into, there have been, one of the world wars is believed to have been initiated because one of the leaders was abusing drugs, which is amphetamine. So drug abuse cannot just be a simple thing. If we have a leader abusing drugs, they can easily plunge a whole country, a whole continent into war. That is how serious and damaging drug abuse can be. And if we don't take a serious look at it, we shoot ourselves in the face.
Thank you very much, Eugene. I was worried when I attended the NACOC program. Now I am more worried. Considering the fact that our TVs, radio, so alcohol alone, one killer. And considering the ramifications of the individual, the family, policymakers can do. I'm happy that there are some key media people here. I throw this challenge to you, that we have a huge problem on our hands that you need to take up. It's a question that we'll also discuss in the final analysis, but you also have a role to play, because we have a much, much bigger problem than we thought. Today we are on time because we need to. So Akosia, are you there?
Yes, please, I'm here.
I want our participants to have the opportunity to ask some questions. So we need to be wrapping up on our interaction. So how is drug abuse? How do you deal with it?
All right, thank you. So briefly before I get to the management, I want to not to intentionally add to your worry, but looking at the situation in Ghana, a study by Brian Akwe Hello.
Drug abuse, they come to your consultant.
Yeah, of course, I hear you. Dr. Arthur,
Yes, we can hear you.
Okay.
Go ahead.
All right. So I said just before I go to the management, I wanted to add, or not to add to your worries, but then the situation in Ghana is quite alarming, such that a study by Brown Akwe revealed the age of incidence of drug abuse to 10 to 12 in Ghana, with the common drug of abuse being marijuana. And that is quite alarming. And it calls for something to be all for all to be concerned to be able to address these issues. So addressing drug abuse or managing drug abuse, I'm going to speak from the point of view of the clinical psychologist and medication for drug and doctor psychiatry. Firstly, drug abuse can be managed with various approaches, and one of it is behavioral therapy. And with this, the main goal of behavioral therapy is to modify thoughts or attitudes and behavior towards drug use. Again, we would want to increase healthy life skills among people so as to not use the drug, and also to enhance adherence to other forms of treatment like medication. We also approach management with group therapy, and with this group of individuals who are recovering from addiction come together to share their recovery progress or things that are helping them and encourage each other. And also they come together to work on various recovery programs so as to be able to stay off or to stop using drugs. Then of course we come to the medication, which are often used to manage withdrawal symptoms and other co-occurring mental disorders like the depressions, the anxieties, and the bipolars. And then we can also have adjunct therapy where multiple or 2 or more therapy approaches will be used, and the goal is just to maximize the effectiveness of the primary treatment. So for instance, someone is being managed with certain medications, and behavioral therapy can also be added to improve or to help the person adhere to the treatment with medications. And just to note that drug abuse or addiction can be treated, but then it is not simple, and most people would need prolonged treatment and even repeated treatment or care to be able to recover their lives fully, or to go or to stop using the medication. So these are the drugs. These are some of the approaches to management that I want to discuss.
To seek for help, and the management is not it's not that strange to us. We understand it now. But let me ask Prof, are there practical ways that I can do to avoid abusing drugs?
Yes, but before then, let me go back a little and talk about, in fact, the influence of drug abuse on our policymakers, our politicians. You may remember, or participants may remember, about 6 or 7 years ago, there was a president of a Southern African country, not South Africa, but Southern African country, who claimed that he was haunted by ghosts in his office. Anytime he went to the office, ghosts were haunting him. And how did he know ghosts were haunting him? He says that they were crawling on his body like ants. So he felt like running away. This is obviously a sign of alcohol abuse. Indeed, even cocaine can happen, but it's very often alcohol abuse, where you have what we call fornication. So you feel like ants are crawling on you. So immediately he said so, it was clear to some of us that this person had an alcohol problem. I later met one of his countrymen and asked him about it. And he says, oh, don't worry, everybody knows that he's an alcohol addict. That is the kind of situation. Now, in this case, it has come out to the public because he came out and said that he was haunted, and they also knew. What about if it was to the point that it was not clinically manifest for people to know, yet you'll be there taking decisions for us? And by the way, drugs also influence our decision-making ability. Indeed, it is everybody. You are growing as your body is growing, your age, your mind, brain is also growing, and you get to the maximum point of the growth of your brain by age 28, so 25, 28 thereabouts. And your forebrain is the part that grows last, and is a part of the brain that controls your decision making. It's actually the executive of your body. So your decision making, your judgment, your being able to see into the future, that's prognostication. All these are qualities of the forebrain, the frontal cortex, and this grows late. And as in the youth, you are abusing drugs while the brain is trying to form, you are disturbing your ability to make proper judgment. So you might, as you abuse it, you go to a certain point that your decision making is faulty. And yet this person is going to be a policymaker to take decisions for us. So imagine the kinds of decisions these people are going to take and the kinds of laws they are going to make for us. So the implications are not just on the individual. It's far, it goes far beyond the individual to the society, and we need to recognize that. Now you ask, and by the way, before I continue, let me also say that we also know that if people begin to abuse drugs of any kind, alcohol, cocaine, marijuana, whatever, in their teens, by the time they get to 45, for every 100 people who abuse these drugs in their teens, by the age they get to 45,
Prof has dropped off. Internet. Prof, you dropped off.
Yes, I dropped off. Sorry. Thank God I'm back. My apologies. I think we are having today has not been good for network. By the way, so I don't know where I got.
Please go ahead.
I think the last point I was making is that for 70% of people who abuse, or for every 100 people who abuse drugs, starting from their teens, 13, 14, 15, 19, by the time they get to 45, 70% of them will be dead. The other 30%, some of them will be on their deathbed waiting to die. Others will be in the prisons because of criminal complications, violence, and whatnot from the drug abuse. Or some would simply have been dropped out, not knowing what to do in life. Or a few would have recognized early enough that I need to be treated, and so they get out of the treatment. So 70% of them being dead, and the other 30% having all kinds of problems. We need to recognize that. And that leads directly to your question. How do we make sure that we don't enter? In fact, the best thing out of drug abuse is just don't start. That's the rule of thumb. Just don't start. You may be pressurized by your peers. If you don't do it, you are a talk, you have not arrived. Guy. They will use all kinds of things to coerce you and to lure you into drug abuse. But be on your feet, stand firm, and tell yourself, be assertive, and tell yourself that I was not taught this in the house. Neither was I taught this in my Sunday schools. Then you'll be able to stand it. I'll come to the role of parents in this matter, because very often, if you've given proper education to our children, for them to know the effects of drug abuse, they will stay away from drugs. And I'm not necessarily blaming parents that if your child is abusing drugs, you are at fault. No, but we know that good parenting also prevents drug abuse a lot. So that is one, we need to be able to stand firm and tell ourselves that we will not do that, whether in schools or at home. Just stand firm. And now we also begin, for whatever reason, you have just started, you just taken maybe a bite or a taste or whatever, and you are lucky enough to get the proper education. At that point, you are not yet addicted, just quit. So first, don't start. Two, if you just started, just quit. But if you realize that in trying to quit, you are not able to quit, then you go to the point where you call it addiction. Then take the necessary steps to seek help. These are very important. Now, going back to the recreational or the peer pressure components. Yes, recreation, you are using this, people will tell you all kinds of things. If you use it, you become high, and it is true. If you take this, you feel that your low spirit is elevated. It is true. If you take this, you are able to stand in front of a crowd and talk. Stage fright disappears. It is true. If you take this, you're able to stay awake throughout the night and study. It is true. But these are the half-truths that kill you. So we call that helper killer. So they are giving some temporary pleasure, but at the end of the day, they are giving you the killer effect. Because as long as you expose your brain, in fact, every time you expose yourself to your brain, you are literally frying the brain or the egg of your brain. Because every single exposure does some damage. Initially, just on the surface of the cells, the brain cells, and later as you go further, the damage within the brain cells, and as you go further, the architecture, the bigger architecture of the brain, and that point becomes very difficult. So just stay away from it. That's the first advice. And you just started, quit. If you cannot quit, seek help.
Thank you very much, Prof. Dr. Dodoi, I have a question for you. And when we are done, participants, please be ready to ask your questions, and then we would move on. Dr. Dodoi, how do I help somebody who is abusing drugs? How do I help? What kind of help can I offer? A family member, a friend, a colleague is abusing drugs. What can I do to help this individual?
Yeah, so for me, the biggest help or the biggest hurdle is to be able to get, the other person should realize that this person needs help. Okay, so once you know addiction is a disease, it's not like he has a bad morals or a defective morals. And then the next big challenge is what we do what to call motivational interviewing. So you need to get this person to also realize that, hey, this drug use thing has gone beyond you. You can't help yourself. So that person admits that they need help. Once we get over these two areas, then probably the help is on the way. I might say that hurdle probably is the biggest and the hardest challenge for you to be able to get the person using the alcohol or the drug to realize that, yes, I do not have control over my alcohol or drug use. So when you are not able to do that, that is when you can seek a professional help. So you can talk to a psychologist, you can talk to, most mental health workers, nurses, most mental health workers will know what to do. Okay, so if we are not able to let the person seek help, then you can get a professional to get the person to seek help. The biggest obstacle is the decision to seek help. That is what usually, because the disease is such that they always think they are in control. Because I know even an uncle who drank for 40 years, he's still well, he's not sick. So why do you tell me in my 30s that I've got a problem? Why do you tell me that I've got a problem? So that is where the challenge is. So the people themselves don't realize they have a challenge. And it's not, so it's for me, the people themselves, the society, the health workers, and the system. Because if as a country, we don't think they even have a problem, how can such a person take, leave from work that I am not well, I need to go and get help? So beyond the individual realizing they have a problem, as a society, we need to also realize addiction is not a spiritual problem. Addiction is not a curse based on anybody, and it's not a moral failure. It's just that some people are unfortunate. When they get exposed to drug of abuse, they get hooked onto it and they need help. So we really, really need this education to understand that it is not a moral failing and it's not their sins or a case. Thank you.
Thank you. I have a question from Dr. Albert Isando. I think it's related to what Eugene you said. He said, here in the US, doctors and pharmacists have been very instrumental in the supply of drugs for drug abusers. In what ways are these entities regulated or managed in the present, are managed to prevent similar occurrence in Ghana? I would allow Prof to respond to that. Then probably Eugene, you can add your voice to it. Prof, are you there, please?
Yes, that in the US, doctors and pharmacists are good in providing medicines and providing these drugs to abusers. Is that right? So they supply,
Yes.
they support that behavior. They support the addiction. Is that not right?
Yes.
Yes. So it's true. I said earlier that drug addiction, actually, the drugs of abuse, prescription drugs, are very often iatrogenic, caused by health professionals themselves. So we provide that, but in fairness, no doctor will give you these drugs of addiction for the purpose of getting you addicted. They give it with the intention of relieving your problem, your pain, or your distress. But then they may not realize that you give it more than you should, and the person gets addicted. And that's why you say these are hard drugs. The potential to get addicted is very high. So the addictive potential. And these health professionals who may not realize that they are endangering you, they are putting you in danger by virtue of starting you, and they continue where the person says, doctor, I need it. And just out of sympathy or empathy for you, they give it to you. They are worse. So often it is doctors who start it. And of course, pharmacists will also give the prescription drugs when it's been prescribed. But thereafter, it is not the doctors and the pharmacists who continue to give. At that point, when they get addicted, these health workers themselves know how to assess these drugs. And that's why they may find ways of getting the prescription for other patients, but using either their own name or the patient's name, and eventually they use it. Or they have means of going around outside the normal spectrum of prescription to collect it, because maybe if you go to a pharmacy shop and you know I'm a doctor, you might not ask too many questions and you provide. So that is where the doctors and pharmacists have a role. But initially, the doctors and health professionals, pharmacists play a role, but thereafter, it is the patients who outwit the system. But this also tells us, and that's why we also need to direct our education to our own colleagues, so they begin to appreciate the danger that lies with every instance of giving a prescription drug to their colleague. So we need to be careful. Once we have that education, that understanding, you will be on our way towards preventing this, the addiction to drugs of prescription or prescription drugs.
All right. Thank you, Prof. Another question. This question goes to you, Eugene. Can I kindly know the pathophysiology of addiction? In other words, what happens in the brain of an addict?
Yeah. So what happens, or what we know in science now, is that people with addiction tend to have what we call low number of receptors in their pleasure center. So there is a part of the brain that make all of us, feel pleasure, either after drinking water, after food, after sex, or after a praise. Oh, you look handsome, you look beautiful. There's some feeling we get. So for people with addiction, they tend to have a lower number of their receptors that will give them this feeling. So for them, they tend to need something outside them to kind of make them feel what other people feel. Unfortunately, when you start drug of abuse, it's down-regulates, which means that it will actively, it causes a change in your brain, a damage in the brain, which Professor was talking about, said that these receptors tend to decrease further in number. It is basically the brain saying that, hey, it appears there are too many of us receiving stimulus, but there's a drug of abuse there. So the brain or the body decreases the number of the receptors. And that is why when you start using any drug of abuse, you tend to require more. You drink more, you use more to get the same feeling. And unfortunately, this is so close to the brain center. the Center for Memory, okay, such that when you feel high, you don't forget how you felt. So there's always a reminder that, I felt good. And then you lose that control of not wanting to feel good again. So you go and use more. Unfortunately, when you use more, you decrease their receptors and you require more. And this is not only happening in the brain. So the other organs of the body, which cannot make you get high, also get the receptors, because the receptors are, the drugs are in your blood. And then they get damaged. And that is how we damage the kidney, damage the heart, damage every organ of our body. So, it's a very serious thing. And that is why we say that when people's, brains have been damaged by it already, that is not the time to go advising them that, hey, this thing is a very bad thing for you. So, stop this. At that time, they need therapy for the brain to, we say the brain is plastic. It is able to regenerate and recover some of the damage when you stop abusing. So we use the rehabilitation center to help the brain to recover from, all the damage that has been caused. And to add to what Albert asked, that is the challenge we have when we try to transpose what we have elsewhere here. So in the US, almost every doctor and pharmacist is known in the system. So when you prescribe, they can know who is prescribing what. We don't have that in the system. Nobody knows who is a doctor. Anybody who can make a stamp can stamp a prescription, and then so it goes. And nobody checks anything. And as Professor said, when the people become addicted, at that point, they don't come to the pharmacy for the drug again. Currently, people who abuse tramadol, they are actually using tramadol doses that we don't even prescribe, up to 200 or 300 milligrams. We prescribe 50 and 100. So, and nobody will sell above 100 in a pharmacy. So when they are abusing, they are no longer using the, pharmacies. So when we make policies and laws to restrict the legal routes, then we increase the illegal use. Unfortunately and coincidentally, that is how we got the name Akpeteshi. I understand it's from the Gan word, the act of hiding. So when the colonizers tried to put restrictions on locally distilled alcohol, we began hiding that one. So people go and ask for, do you have the one that we hide, the local one that we hide? That is Akpeteshi. That is how it means in Ghana, the act of hiding. So you can, and this was even tried in the US in the 1930s, where they banned alcohol. When they banned alcohol, people started producing alcohol illegally. So normally making the formal ones restrictive and all that, we actually increase the illegal ones, the black market. And that is what will increase trafficking of drugs and then increase the crime. So it's a very difficult thing to manage. Do you put in laws to restrict? And this is one of the arguments for us to legalize, even marijuana, because the crime associated with marijuana use and trafficking, it's not worth the effect that it gives. And that's why people say, then we'll legalize it. Because alcohol, which is worse than marijuana, is illegal. But the challenge is that, so if you have one wrong and you have a half wrong, do you add a half and say that because this one is half and this one is one, and I already have one, I want to add it to become 1.5? So that argument is moot to say that because the alcohol is bad and it is legal, then let's legalize marijuana as well. There are other reasons why people want to legalize. But for me, we are not at the level where as a country we should legalize marijuana at all. We have other more challenges than to legalize marijuana. Thank you.
All right, thank you. Thank you, Eugene. Priscilla also asked a question. Please, is there any available medication for management of alcohol abuse and other forms of abuse? Yes, Priscilla, Akosia mentioned how these conditions are managed through CBT, cognitive behavioral therapy, and medication group therapy. So yes, there is. So my advice is, if you have somebody who is experiencing this, support the individual to seek for help, and all other shall be added onto that person. Thank you. Vida also says that some people say that when you detoxify after taking a drug, you won't get addicted. Please, how true is this? Eugene, before you open that fire of yours, is it true or not? Yes or no?
Well, it is not true. I mean, it is not
Thank
true.
You very
so
much.
Detox is the initial treatment for addiction. It is actually not even the treatment, it's just the initial stage.
Thank you very much, Eugene. Short one. Yes, I know what you can do. What happens when an addict genuinely goes through rehab programs but unfortunately relapse? The person goes back because something like that. Well, Eugene.
Yeah, I mean, definitely. It's just like saying that what happens if
Prof will
somebody...
leave us within the next few minutes. So,
okay, so let Prof
will leave us in the next few minutes. So
because this question is very common.
I'll let him make his closing remarks and throw a challenge to the media on how to support to deal with this problem. So, Prof, you have the floor.
Well, let me comment on the last two questions. Whether, well, Eugene has answered that it's not true that detoxification is enough. And also with respect to the rehab, whether it's okay to seek other means such as prayers. Now with the detoxification, by basically detoxification, all we are saying is that you are removing the substance from your bloodstream. Yes, you remove the substance from your bloodstream, but you've not handled the crave in the brain. Right. So you've got a person to be detoxified, and often that detoxification is also very crucial because when they are going through the withdrawal, when the body itself is getting rid of the drugs, because you are not getting the drugs for some time, so the blood levels are going down, then the body reacts because the body is somehow telling you that I need more drugs, I need more drugs, I need more drugs. So if you're not giving the body enough of the drugs, then the body begins to react, and the reaction could be very dangerous, very serious. Those are the withdrawal symptoms. In the case of alcohol, we call that delirium tremens. You may be shaking, you could have vomiting, you could have visual hallucinations and a whole lot of things. And people can actually even die from that. So if you don't handle it, they themselves will be forced to go for more so as to avoid that situation. In the case of cocaine, people can collapse and whatnot. So it is a very painful, in the case of cocaine and heroin, that's what they call cold turkey. You begin to shiver like turkey that is cold. Now, these are very unpleasant situations. So their point is that if you assist me for me to go through this process, detoxification, then I'll be fine. Is it true? No, it's not true. You have only been helped to the extent of that blood level going down alone, but the crave is still there. So you go for it at all costs, because after the body has been without it for some time, then the crave comes. Anything you see that reminds you of the drug, you'll go for that. So you need to handle the crave. So detoxification is just not adequate. But this is not to say that it will not take you through. If you go through the orthodox approach, it will take you through the detoxification. That's a painless withdrawal, but we need to follow it very quickly with handling the crave so that the crave gradually disappears from you. And then prayers. Well, we would not recommend you going through prayers alone. Yes. But prayers to add to the orthodox approach, beautiful. I mean, you go for the rehabilitation, and then whilst in the rehab, your pastor is praying for you at home, beautiful. Prayer can work remotely, we know. But for you to decide that, well, instead of going for rehab, I am going to the prayer center to seek my help. What you are going through is the detoxification there, but after that, the crave will be there. Because let's understand, and it's been said earlier, that it is not a spiritual disease. It's not a spiritual condition. It's a disease of the body, the brain, which is part of the body. That is the issue, and that needs to be handled physically. But you can always add your prayer. In fact, if you go to the 12 steps, one of them is more like a prayer for you to recognize that I have lost control, and for you to recognize that there's a superior being or a superior body that can help you. This is a prayer. So in some sense, yes, but for you to just separate and say that I'm going to the prayer camp, or I'm going to my pastor's house, or I'm going to stay at home and pray, that will not work. And we need to emphasize that. So in my closing remarks, as you said, I will have another meeting that starts shortly. Yes, substance abuse is a major issue. Let me quickly return to this issue of legalization of cannabis, because I think it's important we emphasize that. And I'm happy that when we went for the Narcotics Control Commission program, they emphasized that people say, oh, now cannabis or marijuana has been legalized, so it's free for all. No, the government did not legalize recreational use of marijuana. Government did not legalize recreational use of marijuana. So recreational use is still a criminal offense. And there are different types of marijuana, but broadly, let's talk about the two. The one with the high THC, that's the cannabis sativa, and the one with the low by THC, tetrahydrocannabinol, and the one with the low THC, but rather high CBD cannabidiol, that's the indica, and there are hybrids, others. Generally, it's also the environment where it's grown, and we know the marijuana of whatever type which grows here will have high THC because of our tropical environment. Government did not legalize the one with high THC. Anything with 0.3% of THC and above, that is illegal. And the one that is allowed is the one that can be used for medicinal and commercial purposes, like to make textiles out of it. The danger, however, for which Eugene said, and I also support, indeed, I wrote a letter to the president asking him not to sign when Parliament passed the law, is that you have legalized the industrial use, but the outside person there does not know the distinction between the commercial and the recreational marijuana. So they will, in fact, the farmers will plant both. They will know the difference. The other person out there will not know the difference. So they will plant both. And when it comes to harvesting, they will harvest the medicinal and the recreational one and sell it. And people will be using it. So we should have waited, rather than just looking at the commercial value, the financial component of the medicinal one. You should have waited, knowing very well that human beings as we are, some will obviously go for the recreational and they will get the complications. So you should have waited and prepared the grounds very well so that you have enough rehabilitation centers all over the world. We have enough personnel who will handle these problems. We have been able to resource Narcotics Control Commission so they can go throughout the country to find the recreational ones and destroy them. We should also resource our laboratories to make a distinction between the recreational one with high THC and the medicinal one with low THC. All these preparations should have been done before we legalize it. In US and Co, they have that very well. We don't have it, and yet you just look at the monetary component and say, let's legalize it. Without being a prophet of doom, I can tell you in the next 5 years, you will see a proliferation. Already the challenges, mental health challenges we have from these drugs, you will see probably a 10-fold increase, proliferation of these challenges because of the legalization of marijuana. So I just want to conclude by saying that this is a major issue and we should all recognize it. Unfortunately, even as a country, we are not given enough resources to handle it. Elsewhere, we know that if you spend $1 trying to rehabilitate people, trying to treat people, prevent them from taking, you are getting $8 back. We don't have the data, but it's not different from what we have. If you are able to invest in treating drug abuse, either by way of prevention or by way of early onset recognition and treatment, or by way of full rehabilitation, for every 1 cedi you spend, we can get 8 cedis back. So there is every reason why we should invest in handling these issues once you recognize that addiction is a medical condition and not a criminal offense. Thank you.
Thank you very much, Prof. Thank you very much, Prof, for your input. It's been quite, as usual, extremely powerful. I mean, your last bit has increased my worries. I was already has already increased it, but that is the essence of this advocacy. I did not hear your challenge to the media to take this issue up, Prof.
Oh yeah, the media. In fact, it's very important for the media to recognize that they have a role. And in handling addiction, every single one of us has a role. From the individual, that's me, the efforts I make to prevent myself from taking, the efforts I make to prevent my family from taking, the efforts I make to let the public know. So I, as an individual, I have a role. The family also has a role. The family will need to recognize that addiction is not a disease of the individual, but it's a family disease. For some family members, we call them enablers. They will enable family members to be taking the drugs. Others will describe them as mascots. They will, by their conduct, will in fact even encourage, like they are using their condition to cause entertainment. So family members have a big role. Once we recognize that it's a family disease, then together we all come together to see how we can help this person. Society has a big role, making sure that we don't get the drugs exposed. We don't get it everywhere for people to get hands of it and then use it. We will need to support the, like alcohol policy, now alcohol law. We need to support this so that it becomes widespread. We reduce the incidence of it. Indeed, when we were trying to draw the policy, alcohol policy, we said that it should not be advertised on the national media or even radio, TV before 8 p.m. Many people were not happy, but that is so, because if you advertise it at the time the youth are there and the youth are very impressionable, then you are exposing them. So you should reduce exposure to the barest minimum. So that's the role of the society. Media has a big role in this matter. Often they are only attracted by the money they will get, and definitely we know there's a lot of money. So if the alcoholic industries come and give money so that they advertise, they will take the money. They give all kinds of adverts in the form of bitters and whatnot, and all these are actually advertising alcohol. So if they recognize that they are doing a lot of harm by taking these adverts, and they put some ethical measures in their own marketing and adverts, they'll be able to help reduce the incidence. And of course, as a nation, if we put in place the necessary measures to prevent, resource the bodies, agencies responsible for educating and treating, then we're doing a lot of good. And if you have any way of reversing the legalization of marijuana, even though it's the low THC marijuana, I would say let's reverse that legalization. Thank you.
Thank you very much, Prof. I have 4 final questions to address. So on this occasion, if Prof vanishes, we understand. He has another. We have a comment from Ima. Please, he says, what is the effect of electronic smoking, as some advocates are calling for its legalization in replacement of ban on marijuana to help deal with addiction? What is the effect of electronic smoking? Dr. Dodo, are you there? Okay, I'll come back to this question. Akosi, I think you should be able to help with that. It says, please, what can I do as a mental health practitioner when I notice someone is abusing or addicted to a drug, but is not willing to help? What can I do?
All right. So,
Hello,
yes, hello. Can you hear me now? So, as a mental health practitioner, if someone is abusing drugs but unwilling to come seek for help, there's still something you can do. However, the key thing is when the person acknowledges that his or her drug use is causing a significant problem to him and is willing to stop using the drug, that becomes easier for him to be supported. However, if he is not, you could also recommend him to see a clinical psychologist or any other health person who could help him to be able to understand what the drug use is causing, the effect the drug use is causing on him or her, so the person can access help or receive the necessary help. Yeah.
All right. Thank you very much, Akusia. Today, I see a lot of friends, Lady Na, Sarah, Dibodi, Genevieve. Well, thank you all for coming. And Dantela for coming late. Yes, I see you. Eugene, there was a question that I would want you to respond. Please, what is the effect of electronic smoking? As some advocates are calling for its legalization and replacement of ban on marijuana to help deal with addiction. This individual, I don't know whether he wants to use it or wants to be sure before he uses it. But anyway, what is the effect, Eugene?
Yeah, so e-cigarette
He probably wants to advise somebody.
Yeah, so e-cigarettes are for like nicotine abuse. So people who smoke cigarettes, that's largely for them. It's different from other forms of addiction, and we don't want to replace one addiction with the other. But currently, what studies have shown is that of opioid addiction, which is the pain medication, based on how they work to give you the high. There are medications which are in the form of injections that when you take, they are what we call, antagonists. So they block the effects of the pain medicine to give you high. So if once we give you that injection, anytime you abuse heroin or anything, you don't get high. No matter how much you take, you still don't feel high. So with that, some people have been able to stay away from drug use and then return to their productive lives. But when it comes to e-cigarettes, it is a bit different. From the other forms of addiction, in the sense that people who smoke cigarettes are not necessarily those who stop working, but it gives them many other conditions, cardiovascular risk, cancers, and all that. And that is why it is considered a safer risk. So in fact, it is an approach to addiction called harm reduction. So yes, smoking gives you a lot of harm, particularly lung cancer. So let's decrease the risk so that you can only get the cancer that is caused by the nicotine itself, but not just the smoke. And that is how these things work. So it's a form of reducing the harm associated with addiction. And like I said, it's also a form of therapy. Currently in Ghana, the only approach we have is total abstinence, which is also not the best. Thank you.
Okay, not a replacement. A replacement doesn't solve the problem. Pure Kati asks that, Doc, please, what is the best first aid advice would you give to a teacher who has students exhibiting signs of substance abuse in the classroom? I think Dr. Dodoe extensively dealt with that one.
Yeah, I think I responded to that in the chat.
Yes, extensively dealt with that. They need help, convince them that they need help. They would have to admit that they need help, and you seek for professional help. First aid is talking to them of the harmful effects and how it will affect their future. Vida, please, is it true that doctors prescribe alcohol to patients before surgery? I have met people who say it was prescribed to them. Dr. Dodoe says there is no truth in doctors prescribing alcohol. Curtis says, thank you very much, Prof. Okay, on this occasion, I think we are almost out of time. So I would allow our panelists, Dr. Dodoe and Akusia, to make their final remarks and throw a challenge to the media out there, because clearly we have a huge problem on our hands. We have a huge problem on our hands. We cannot underestimate it. we will do our best, but we need the media. So to allow panelists to throw the challenge to the media to support us. So let's start with you, Akusia.
All right, thank you, Doc. So I would start by saying that persons who abuse substances, like we said, it can be treatable. Substance abuse can be treated, although it is difficult. And people who are abusing substances or addicted, they need to be offered psychosocial support. So families, authority figures, friends, anyone who sees somebody abusing substances has a role to offer psychosocial support. And this support should be one that shows understanding of the situation and our readiness to help the person, rather than ignoring or getting fed up with the challenges that are associated with some of these things. To the media, I will say that they have a huge role to play. Prof has already mentioned some of them, but they also need to increase awareness on some of the risks that are associated with drug abuse, and also discuss or address some of the common drugs that are abused in our societies, so that people can learn to stay off these medications. So the key thing is prevention. And if already the person has started using it too, we need to support these people to be able to stay drug-free. Thank you very much.
Thank you very much, Akusia. Eugene.
Yeah, thank you very much for this opportunity. And I think the
your final comments and your challenge to the media.
Yeah. So I was saying that the media has a huge role to play in this. Currently, addiction is at epidemic proportions in North America and Western Europe. We have not had gathered our data to know, what the enormity of the problem. So, and the fact that we don't have data does not mean there is really no problem. Okay, so what we need the media for, and as I'm sure they might have heard even during this short discussion, is that even health workers, they may not necessarily understand addiction. So if we need to do mass education, it's definitely through the media, and we need them. So it is through what they do that we can educate our populace to understand that there is a disease called addiction, which is not because they have a moral failure, or because they are not Christians, or because they are sinful, or because they have haram or anything. It is none of their fault. They are ill, and that we cannot allow them to be ill, thinking, based on our own prejudices and biases, that they cause it themselves. So the media need to come in and help educate the populace, not only the populace, but rather also the policy makers, like I said, including health workers, to understand that there's a disease called addiction. It needs to be managed, and it's not a disease that affects one person and kills the person. It's a disease that affects one person, influences society. In fact, if not because our addiction can make drug to be sent to America and Europe, they wouldn't have supported us in our fight against drug abuse. But they support us like they support us in TB and HIV, because they don't want it come to their end. That is why they support us. So if somebody has realized that we can even infect them with our addiction, why are we not putting in the effort to control our addiction? And as we say in the addiction circles, or even in Chi, let me say the Chi one here. As I said, so if we are able to stop the demand for hard drugs, the supply will also go down. If we don't have people who abuse alcohol and abuse hard drugs in Ghana, nobody will be able to traffic heroin and cocaine through Ghana. They need people in Ghana to abuse them, sell it, make money to hash and pay off to their traffickers. So it is very important that we manage, we prevent the people who do not have it, the young people. Those who have it, we treat them, and those who may have had a complication, we rehabilitate them so that they don't necessarily have to go back and use drugs. And I think it is, a shared responsibility. The health worker, the politician, the policymaker, and the media at large. So we need them on board, and they need to get on board to save our nation. Thank you.
Thank you very much, Eugene. As usual, you bring fire. At this point, I think I should be rounding up, but to demonstrate what this program means to our Deputy Chief Executive in the person of Dr. Caroline Emisa, is also part of us every day, all the time. So I'll let her round up, then I'll just say thank you. So Dr. Emisa, she will say the closing remarks, and I'll just say thank you, because it's been wonderful. It's been just wonderful. Dr. Emisa, can you hear me? Hello, Dr. Emisa. Please unmute yourself.
Thank you. So I was trying to unmute, but I wasn't being allowed to unmute. Thank you very much, Dr. Aka, and good afternoon to all of us. Like Dr. Aka said, the Mental Health Authority has been doing a lot of these health education or sharing on some topics that we think are relevant to or to helping us maintain or improve on our mental health. And today's discussion has really, really, really been insightful. I'm sure most of us who have joined have made a few comments here and there. I want to first say a big thank you to our resource persons. We had very seasoned resource persons. Dr. Dodoy has worked in the area of drug addiction and abuse for some time now, and we all could tell. Prof the same, and Akosia also gave us some aspects of how to manage or go about it when it happens to us. So we've learned a lot. We've talked about causes, how we are predisposed, or some of the risk factors. We've talked about how we can manage it, and the fact that it can affect anybody or everybody. So it's not really, yes, we know it affects the young people most of the time because of peer pressure and all that, but it can affect all of us, especially as adults, when we think that we're in control of ourselves. So we've learned a lot, and we've learned about the effects. So maybe before I wrap up, I would like to say that we've all given good messages to the media, but we should also be advocates ourselves. I'm sure as individuals, where we work, within our families, within our communities, sometimes you hear people talk about some of these things, or we know people whom we see as persons who must or may have been involved or are involved in drugs. Sometimes you are not too sure how you can go about it. But I believe when we approach the person, establish some kind of rapport, they are professionals who can do the proper management, the handling. So people could come to you as a health person. Don't throw them off. Don't say it's not your area. Or if sometimes when we refer them, they don't go. So you can do the initial contact on their behalf. I believe that also works. And I'm sure we are ever ready. Hopefully our hotline will come up very soon. The MHA has assessed the hotline. We are yet to see how to manage it, as in paying for the services, like the calls, etc. If somebody calls you, how do you call them back? Even if they don't have credits, you need to be able to sustain the conversation, especially where we clearly see that they need help. So I'll say a very big thank you to all who have taken part in this, especially our resource persons. And Dr. Asa, your topics are really interesting, and we are happy that we always learn something new and we improve and better our mental health. Thank you so much. And maybe before I leave, the other thing I'd like to say that we've talked a lot on how to manage it, but I think prevention for me will be very, very important. Yes, there could be alternatives to doing drugs. If you want to be excited, if you want to be happy, you can occupy yourself, do other things which can excite our brains, etc., but not necessarily get into something that eventually we will not be able to control. So probably that is what I would want to leave us with. Thank you. Thank you very much. I'll take leave of you. Thank you.
All right, thank you very much, Dr. Nisa. Ladies and gentlemen, should I say all too soon? All too soon, our program has come to an end. From me, participants, for taking time off your schedule to join us. Those who intend to abuse, let's advise them not to. If they've started already the process, they should quit. They shouldn't start at all. Those who have gotten to the stage of addiction, it's a disease now. It is our job to support and assist them to seek for help. Let's not neglect them. I'm pretty sure that all of us here have that sort of idea. But what about those out there who do not? It's our job to educate them. So as let's also, in our own small way, educate others outside so that they'll support these individuals to avoid it or to seek help. My name is Dr. Yawata, Mental Health Authority. Thank you so much for joining us. God willing, same time next month, we'll see each other with another exciting topic for discussion. Thank you. Enjoy your weekend. Bye-bye for now.